Hi, my name is Alexis Cardona. The topic that I chose was regarding health plan coverage, the healthcare issues that we see on a daily basis, or when we try to choose a plan that best fits our needs when it comes to healthcare plans. Um, I have a few reasons why I chose this topic. One, because a few years ago I suffered from an infection and I could not get seen um, with professionals due to my health coverage. I didn't really have a plan that was able to cover all of the exams and doctor visits. So I kind of focused and aimed towards this route for the healthcare issues. Other reasons why I chose it is because I have my mom. She she was diagnosed with lupus, and recently she was diagnosed with arthritis. Um, and with one of our health plan coverage that we were able to qualify for was because we we basically landed in below the poverty line. In the state of New Mexico, there's a certain amount of income that you may receive in order to qualify for health care, and we were able to fall under that aspect. And so because of those reasons, and also because of my dad and him having to go through back surgeries, and we would always have to call the insurance companies, making sure that the procedures would be able to cover, making sure the medication was also being covered by the health plan. And those are the reasons why I chose to speak in regards to the healthcare issues that we have here in the United States. And currently, right now, let's move on to the presentation. Let's see. Alright, so purchasing healthcare. We recognize we have to recognize characteristics when purchasing a healthcare plan. We have to focus on, well, first and foremost, we have to know exactly why are we choosing this plan. Is it because we're getting sick constantly? Are there children in the household that require to have healthcare plan? Are there adults that need to be covered under the plan as well? Or even the elderly people, we have to make sure they have coverage too. When you get older, you need to have these types of healthcare plans in order to be seen with specialists. So what exactly does the plan cover? So we have to make sure that the plan covers doctor visits. Are there deductibles? How much is the deductible? Do you have to pay for medication? If you do, how much out of pocket do you have to pay? So we have to basically look into a lot of these characteristics that many healthcare plans, some don't even cover doctor visits, and if they do, you have to make a co-payment, and sometimes that price is too high, especially if we fall under the poverty line. And now, of course, it is mandatory to have healthcare plan. If for any reason you do not have healthcare plan, and come income tax season where you have to file for your taxes, you have to bring your insurance plan. If for any reason you do not have an insurance plan, unfortunately there's a penalty fee that they have to basically give you, because you're not complying with the United States rules as far as healthcare plans. And we'll talk about that a little bit further moving on to the presentation. Let's move on to the next slide here. Alright, where to look for healthcare plans. So basically, in the textbook, the Consumer Economic Issues in America, in the textbooks, it basically gives us a little idea where we should look for services. A good place to start is the internet. Nowadays, you can find a lot of things in the internet, especially talking about the healthcare plans. You can find all of the information needed on the internet, or depending on what state you live in, you can go to an official website where they provide healthcare plans. For instance, I believe New Mexico, we have a few. Healthcare.gov is one of the popular websites where you can basically just punch in your zip code and it'll list the city and the county that you live in, which is very easy for many people to do it this way, to find these plans on the internet, because it's listed there for you. You just type in your zip code, it'll find you a lot of list of insurances, and you can read on them. You can select what plans they have, which ones are beneficial for you and your family. You want to make sure that it covers everything that you need the insurance for. And I will also be talking about that a little bit further into the presentation. But researching what plans best suit your family needs, that's important. Again, because if you have newborns in the home, you want to make sure that they're being seen annually. Sometimes they require to be seen every 3 to 6 months. If they have any conditions or anything like that, we want to make sure we can help them and they get the coverage needed to continue to be seen by professionals if they have any health issues. Also, most clinics offer assistance. Some of them have programs like Help New Mexico. That's a website that here in this area is used a lot. Also, if you're not 100% sure how to use like the internet, which I know many people are afraid of using a computer because they don't know about technology, so sometimes they're scared of even just turning on a computer, not because they're uneducated or anything like that, but because they don't know exactly where to research, or they don't know how to do the research. So sometimes we have to come in and step up to help these individuals. And also that's why it's important for us family and consumer science majors to think about, because this is our job. We're going to be helping a lot of people. And for instance, here where I live, it's a small town, it's a small community. It's Chaparral, New Mexico. It's 45 minutes to an hour drive away from Las Cruces. I'm 15-20 minutes away from El Paso, so we're around the area where we can basically we get the best of both cities, El Paso and Las Cruces. And here in Chaparral, we have social workers in the Clínica de Familias, where they can work with you one-on-one to find plans to see which ones best suit your needs. One of the social workers here in Chaparral had actually helped me personally find particular coverage. Because I fall under the poverty line, I was able to qualify for I believe it was Medicaid, if I'm not mistaken. So basically that was last year. This year I have to renew the application, because keeping in mind you have to constantly keep up with the regulations that the coverage plans require for you to meet. If you do not qualify for them, then unfortunately you have to be removed from the plan. And the social worker has always been able to help me in that aspect. And let's move on to the next slide here. Alright, so slide 4, acknowledge consumer problems. It basically, I wrote about where a lot of consumers aren't very aware of what is important or not important when when involving the healthcare plans. According to Garmin, asking the physicians about consumer problems is helpful, but it's not enough. You can use the internet again, other sources to identify problems that can be occurring in the area. Most importantly, you don't want to be seen by a physician who has a previous negative work ethic that prevents him from continuing his practices. Or if you don't feel comfortable being seen by the practitioner, then you have many other options to call your health insurance plans so they can help you find other physicians. You don't necessarily have to stay with a physician that you don't feel comfortable with. Also, you can make a short list of principles that are important to you. Those are some of the problems that us as consumers sometimes have. We don't take into consideration what are our needs. We have to basically just develop them. We have to make sure that we can access all of this information on the internet, or if we don't have access to internet, we can speak to a social worker and they might be able to help us. And that's very helpful. Let's take that one. All right, and then on slide number 5, issues in healthcare. Let's see. So other problems that consumers that we may have is that whenever you go into a doctor's office, sometimes the language is very confusing and any procedure is complex due to healthcare being way too scientific, and consumers have a hard time understanding these issues. Again, it can even we can even make bad decisions, or I wouldn't say bad decisions, but decisions that we're not aware that are good for whoever is being seen, such as the patient, the client. Variety of the plans with the healthcare plans to choose from costs a lot. It is difficult to determine reliability on that coverage. You have to, and that's the bad thing too about healthcare plans. You don't really know exactly what will happen to you, so you're not aware to look into, like, for instance, does this healthcare plan cover kidney issues? Does this healthcare plan cover issues involving back pains? Or will it cover issues if you have a disease, if you have cancer, leukemia? Will it cover all of these diseases, infections? We don't know until it is actually occurring and it is time to use and put the healthcare plan to use, I would say. A consumer cannot get a hold of the databases either on the malpractices that physicians make. That's what I was also talking in regards to the previous slide, that if the physician has, for instance, a bad reputation, such as a criminal conviction, a substance abuse, sex-related offenses, misprescribing of drugs, as the textbook mentions, false information of the state board, loss of hospital privileges, insurance frauds. We don't really have like a section or a website where we can go to research on this physician. And if you can research the physician, then you might be lucky. You might be able to be like, oh well, I found this physician, it looks like he had a felony, I don't want to be seen by him. Or if you have to go through surgery and you don't feel comfortable going under the knife by the physician, we don't have that database to look into, which is wrong. We should have the ability to we should have the access to look into that, to see who is treating us. Why isn't there a database where we can see this information if they have any felonies? I understand that it's personal and it might have happened many years ago, but we should still have the right to know if this person, if they're a sex offender. You definitely you wouldn't feel comfortable going under the knife knowing that the physician has had some serious offenses. And let's move on to the next slide here. We obviously have a broken healthcare system here in the U.S. Healthcare plans being mandatory, it makes it hard for some people to obtain. Obviously, like I mentioned before, the prices are way too high. They don't have a source of income to keep up with payments, because monthly payments for insurance plans, they are high. You're looking at possible $100 to $300 a month on just pure coverage. I know I used to work for a company and they would require for you to have the insurance plan through the job, and they would take away $250 per month on insurance that was not beneficial for me. Every time I would have to go to the doctor or get some type of blood test or anything like that, I would have to make a copayment, which is something you would see as logical for the health plan to be covered, since you are paying a lot of money per month, which I will also jump in to why a lot of young people pay higher prices for insurance plan than most other people, and we'll touch base up on that. We do know that the United States is in poor conditions when it comes to healthcare plans. Actually, the government of the United States, they have been unable to find the perfect solution for their citizens. Here in the US, again, we saw Obamacare. Some people liked Obamacare, some people didn't. There were a lot of people were not covered when they were supposed to be covered, and vice versa. So we definitely do see this going on here in the US at the moment. Alright, so some of the problems and some failures in healthcare, as stated here on the slide, insurances, they avoid insuring people with serious and potentially serious health problems. Some people may be suffering from a mental illness, and unfortunately their coverage doesn't cover the cost to be seen by a therapist or a psychologist, or even go into psychiatry, it being an expensive field. Some people unfortunately aren't covered even though they do show signs and have a disability certification, and sometimes they are not even covered through the coverage plans, the healthcare plans. Also, 82 million went without health insurance at some point in the past 2 years. 1 in 3 adults younger than age 65. So those are high numbers. People who weren't being insured through these health coverage plans, and then only 3/4 of population weren't receiving the healthcare coverage plans because of their annual income. So people who would make $50,000 a year, unfortunately, they would not meet the qualifications for healthcare plans, and they would have to pay out of pocket, because apparently receiving $50,000 a year is a lot, and you can afford all of these expenses. Whereas if a person who is receiving only, let's just throw a number like 25,000 a year, they cannot afford any expenses, like hospital stays or medicine or anything like that, which is funny because I know people who have businesses and they make over $50,000 and they cannot afford to be seen by a doctor. They cannot afford to purchase medicine. They can't afford many other things that healthcare plans should cover, which is something that consumers tend to be poorly informed about the medical care products and services too. Some of the failures that consumers make, and I am actually at fault for this as well. Consumers are often unable to evaluate the quality of medical services because of its scientific language and complexity, which leads to poor decision making. I mentioned this earlier, that sometimes when you go into you're at the hospital and there's a procedure that needs to be done to one of your family members and you're not aware exactly what's going on, all you can think about in your back of your head is just help my family member, just help my loved one recover. Sometimes accepting or approving some type of procedure is a poor decision making, whether because it's not beneficial for the client and or because it's an expensive procedure that the healthcare coverage plans do not cover and you're not aware of this. Another failure that consumers make, they cannot compare prices for prescription drugs, physician procedures, or hospital cost. There isn't really like a place where you can go and like Google like certain type of prescriptions, like how much does this cost, how much does this other medicine cost. People aren't really like realizing that there should be some type of website where people should go compare prices for these, so they don't have to go spending hundreds or even thousands of dollars on medicine, where they can get like some type of generic medicine that is even more helpful for them than the original prescription drug. Consumers are not engaged in reforming the healthcare system, which is something that they should also look into. There are many people who were fighting that Obamacare, and some of them were even doing protesting, and that's something that would be helpful here, to basically engage in getting the healthcare coverage reformed. That would be very also, who doesn't have healthcare? This is something that really does bother me a lot. As a family and consumer science major, I know I will run into this a lot, basically because that's what our job is, to help the people in need be able to succeed in life and be able to help them participate in society on a daily basis. In the textbook, Garment states that the uninsured, they are the poor, near the poor, working poor, and many middle income consumers. This is something that really does affect many people locally, because in Las Cruces, we really do have a high percentage rate of homeless people. Currently, right now, I'm doing an internship with Families and Youth and Corporations over at El Crucero, which is a housing program. It's a supportive permanent housing program. And many of the people who are living in this complex is because they don't have a source of income. And if they do have a source of income, they receive very low pay. And that's the reason why they can qualify to be living here under the permanent supportive housing. Other individuals lose their healthcare plans due to unemployment. I know I had lost mine due to the fact that the company had shut down, not because we were doing bad at the job, but because the company could no longer afford paying us. So we were basically just laid off. Due to that, we had lost healthcare coverage through the job, and that's very bad. We want to make sure that we can at least obtain healthcare coverage a few months after, even if any company closes, so they don't have to lose their healthcare plan coverage immediately upon being laid off. So, slide number 10, the young who overpay for healthcare plans. This one caught my attention a lot. So, I'll talk about that here in a bit. So young people being quite healthy, they pay more, and that kind of makes like it doesn't make sense, but I could see why people think that way. Um, so basically, the younger you are, the healthier you may be, according to whoever did the study, determining um, why the young people pay more and why they should pay more. What young people don't know is that there are hidden taxes that many people do not know about, to care for the uninsured people. However, that percentage, it goes to other people who make profit out of it. It doesn't necessarily go towards a person who does not have healthcare coverage. It does go towards a person who does not have coverage, but only a certain percent goes to that person. The rest, the remaining balance of that percentage goes to somebody who's making profit out of it, out of a young person paying out of pocket and their taxes being used for them making the profit. The younger generation will soon realize, and the textbook even mentions this, that they will realize and rebel towards healthcare plans and the government. So when that does occur, and I'm pretty sure it's still going on, right? It's occurring now. Not that I've heard of personally, but I'm sure this does happen around the United States. That they're realizing that their taxes is going towards like profitable other companies who make profits. Alright, so slide number 11, ways to reduce trips to the doctor and hospital. If a person does not have the coverage, there are ways to prevent having to go to the doctor. For instance, a person who cannot afford the healthcare should consider the following, like reducing or eliminating tobacco usage, reducing or eliminating alcohol usage. Eliminating these two drugs, tobacco and alcohol, it will reduce the visits to the hospital stay. There's a graph here in the textbook that shows, let me find it here. There's on page 379, there's a graph that shows the top 10 official causes of death. The top 9 underlying causes of death, and tobacco and alcohol are one of the, and diet is one of the main 3 high numbers that people are dying because tobacco use, alcohol use, and diet and inactivity. So just looking at the numbers that being high, if a person gets some type of education, or we spread awareness that tobacco, alcohol, diet, or inactivity can cause heart failure, can cause cancer, diabetes, kidney failure, a liver disease. Just eliminating those 3 important causes, such as tobacco, alcohol, diet, and activity, it will reduce the amount of money a person can be spending per year, if of course they're an active user. If they're not an active user, well, there's no need to encourage them to either use it or to leave it alone, because they don't fall under that umbrella. And those are the 3 reasons, ways to reduce trips to the hospital and the doctor to help save money. Alright, so prescription drugs, slide number 12. Many deaths can be prevented by changed behaviors. That's basically what I just mentioned in the last previous slide. If we educate people to leave or eliminate the usage of tobacco, alcohol follow healthy diets, and remember to exercise regularly. Changing that behavior can help many people. Preventing getting sick allows a person to save a lot of money in the long run. Prescription drugs are expensive here in the United States when a person is uninsured. So the fact that we can educate people and bring awareness that all of these other things can cause trips to the hospitals or trips to the doctor, we can educate them to know about illegal drugs, sexual behaviors. People can get STDs, HIV, and AIDS if they're not being safe. Firearms, if people aren't using firearms in a safety manner, we want to make sure that we can bring awareness to all of these issues, to be able to help people, because at the end of the day, prescription drugs are expensive, and if you continue to participate or engage in any of these causes, chances are that you will have to end up paying for prescription drugs out of pocket if you're not insured. And if you are insured, well, that's good for the person who does have the assistance, but majority of the people don't. And on the next slide, it is it's a guideline for medical assistance. As you can see on the far left, it has the household size, 1 through 8, the percentage of poverty, which is color coded in green. If you fall under this particular guideline, you can qualify for healthcare here in New Mexico. As you can see, I got the information off of the Human Services Department. This is also the guideline that I was able to use when I applied for the services. I also entered, let me explain I also entered the 2019 and 2020 guidelines for medical assistance division. It has the same information, but the numbers are totally different. For a person who can qualify for assistance, it would be all the way up to the 138%. Those numbers are the amount of monthly income that a household may receive. As long as you fall on or below that amount that is listed here, you can qualify for free health coverage here in the state of New Mexico, which is pretty great. Why is it important for family and consumer science majors to have an idea of healthcare coverage? We will work with families who will need figuring out healthcare plans. Again, women who give birth will need healthcare plans for themselves and their newborn. Our job as family and consumer science majors is to find resources for individuals who need them, acknowledging all of the resources and apply the knowledge we have in healthcare plans to assist us in our daily basis work settings. Of course, depending on what type of job you may have. Some jobs require for you to know insurance plans. Some jobs only require for you to just know the names of the plans, while some other jobs don't even require you to know nothing about healthcare insurance plans. But it just depends on the person. And that is my presentation in healthcare plans. Thank you so much for your time.